Hi friends, welcome back to the channel. Today's video is a big one. We're diving deep into something that affects millions of women worldwide and can make conception a little more challenging: PCOS, Polycystic Ovary Syndrome. We're going to talk about what PCOS is, how it affects fertility, what symptoms to look out for, and most importantly, what you can do if you're trying to conceive with PCOS. So let's jump right in. PCOS stands for Polycystic Ovary Syndrome, and it's a hormonal disorder that affects how a woman's ovaries work. There are three main features of PCOS: irregular periods, which means your body isn't ovulating regularly; high levels of androgens, also known as male hormones, which can cause things like acne or unwanted hair growth; polycystic ovaries, where the ovaries are enlarged and contain many small follicles that may not develop properly. To be diagnosed with PCOS, most doctors use what's called the Rotterdam criteria. If you have two out of the three features, you may be diagnosed. One of the biggest struggles women with PCOS face is irregular or absent ovulation. And as we know, ovulation is key to getting pregnant. In a typical cycle, an egg matures and is released. That's ovulation. But in PCOS, hormone imbalances can prevent the egg from developing properly or being released at all. So you might have long cycles, no cycles, or unpredictable timing, which makes it much harder to conceive naturally. It's important to remember, though, PCOS is one of the most common, but also one of the most treatable causes of infertility. Many women with PCOS go on to conceive with the right support. PCOS doesn't look the same for everyone, but here are some common signs: irregular or missed periods, excess facial or body hair, acne, especially on the jawline or back, weight gain or difficulty losing weight, thinning hair on the scalp, dark patches of skin, often on the neck or underarms, difficulty getting pregnant. If you're experiencing any of these, it's worth bringing them up with your doctor or OB/GYN. There's no single test for PCOS, but your doctor will typically ask about your symptoms and cycle history, do blood tests to check hormone levels, possibly order an ultrasound to look at your ovaries. PCOS is a diagnosis of exclusion, meaning your doctor may rule out other possible causes first. Getting a clear diagnosis can take time, and honestly, it can be frustrating. But it's the first step to getting the right treatment. The short answer is yes. You absolutely can get pregnant with PCOS, but it may take more time, patience, and a little extra support. Here are some common treatment paths for women trying to conceive with PCOS. Lifestyle changes. Losing even 5 to 10% of your body weight, if you're overweight, can help restore ovulation and improve fertility. Eating a balanced, low glycemic diet, managing stress, and getting regular exercise all help regulate hormones. Medications. Doctors often start with medications like Clomid or Letrozole to stimulate ovulation. Metformin is also commonly prescribed, especially if insulin resistance is involved. Supplements. Inositol, especially myo-inositol, vitamin D, omega-3s, and NAC are often recommended. Always check with your healthcare provider before starting anything new. Assisted reproductive techniques. If first-line treatments don't work, options like IUI or IVF can help. Let's talk about some things you can control that support fertility with PCOS. Focus on whole, nutrient-dense foods, especially fiber, lean protein, healthy fats, and low glycemic carbs. Stay active. Regular movement can help with insulin sensitivity. Get quality sleep. Aim for 7 to 9 hours each night. Limit stress. Easier said than done, I know, but mindfulness, yoga, or journaling can really help lower cortisol levels. Track your cycle. Even if it's irregular, keeping tabs can help your doctor and give you insight into your patterns. And don't forget, you don't have to do everything perfectly. Progress over perfection is the goal. If you've been trying to conceive for 12 months and you're under 35, or 6 months and you're 35 or older, it's time to see a fertility specialist. But even before that, if you suspect PCOS and haven't gotten answers, advocate for yourself. You know your body best. It's okay to ask questions, get a second opinion, or seek out a specialist who truly listens. If you're watching this and thinking, this sounds like me, you're not alone. PCOS can feel overwhelming, but it's absolutely possible to take control of your health, manage your symptoms, and build the family you dream of. I hope this video helped you feel a little more informed and a whole lot more empowered. If this video helped you, give it a thumbs up and don't forget to subscribe for more content like this. Sending you lots of love and baby dust. Thanks for watching, and I'll see you in the next video. Take care and stay hopeful.